pause for a second. When was the last time you truly noticed your toes? They've carried you from place to place for years, one step after another. Yet they're among the most overlooked parts of your body. But what if those same toes were sending a quiet warning, one important enough to protect your life? The body doesn't always cry out. Sometimes it murmurs, and those murmurs can be tiny at first. A faint tingling, a subtle shift in color, a fleeting numbness that comes and goes. It's easy to shrug it off as exhaustion, tight footwear, or sluggish circulation. But what if that small signal is the opening note of a deeper problem? Cancer doesn't always present as a lump or an obvious wound. It can begin in the places we rarely inspect. Your toes, your nail beds, your skin tone. These can mirror what's happening below the surface in your blood, your nerves, even your lymphatic system. Some people only sense trouble when their feet began to change. A dark spot that never healed, persistent tingling or swelling that refused to fade. What looked harmless at first later led doctors to early clues of skin cancer, blood cancer, or distant spread. That's why this message matters. The sooner we pay attention to the body's subtle language, the better our odds of pushing back. As you continue watching, glance down, yes, at your own toes, and really look. Do you notice anything new? Any sensations you don't remember feeling before? There's no need to panic. Awareness is the first layer of defense. Your body is always speaking. Every shift in color, every sensation, every small ache is a vocabulary. And your toes might be talking right now. Stay with me, because in just a moment, we'll uncover the 15 quiet signs of cancer that often begin from the feet and move upward, the signals most people dismiss until it's too late, but not you. You're here to learn, to listen, and to act while there's still time. 1. Burning or unusual warmth. Have you ever felt a strange burn or heat radiating through your toes? Even when the room is cool and you haven't been walking or exercising. It might flare at night just as you're trying to sleep. A sensation like warmth glowing from inside the skin. You change positions, peel off your socks, and still the heat lingers. It's easy to label it poor circulation or a cranky nerve, but sometimes it's more than discomfort. It can be a signal that something is shifting in your blood, your vessels, or your nerves, systems that certain blood-related cancers can quietly disturb. Conditions such as leukemia or polycythemia vera can thicken the blood and slow its movement, which reduces oxygen delivery to the smallest vessels, especially in the toes and feet. Tissues that aren't getting enough oxygen start to protest, and you may feel burning, tingling, or internal heat, even when the skin feels normal to the touch. This warmth isn't always steady. It can come in waves, often stronger at night or during rest. When you lie down, circulation patterns change just enough that low oxygen in those tiny vessels becomes more noticeable. Over time, the burning can spread or be joined by redness, swelling, or sensitivity to light pressure. And while diabetes and other forms of neuropathy can cause similar problems, cancers affecting blood and bone marrow can trigger the same sensations through inflammation and compromised blood flow. Think of your blood as the body's delivery line. When cancer alters it, making it thicker, slower, or crowded with abnormal cells, the most distant areas, like the toes, are often first to register the difference. If you're feeling this burning or unusual warmth regularly, and there's no obvious injury, infection, or diabetes, treat it as a meaningful clue. The body rarely creates these sensations without a reason. That heat in your toes may be your system's quiet warning. Something is changing inside, and it deserves your attention. 2. Discoloration or thickening. Your toenails reveal more than you might imagine. They are not just protective shields or cosmetic details. They can serve as small windows into your overall health. Take a careful look. Do you notice a dark line, a brown streak, or a bruise-like mark beneath a nail that refuses to fade? It is easy to blame tight shoes, an old stubbed toe, or a forgotten mishap. But what if it is not a bruise at all? When a line refuses to move upward with nail growth, it may point to something far more serious. Subungual melanoma is a rare yet dangerous skin cancer that begins beneath the nail plate, hidden in a place most people never think to examine. Because it lives out of sight, it often escapes notice until it is advanced, making treatment more complex. In its earliest phase, it can appear as a thin brown or black stripe. With time, it may broaden, darken, or cause the nail to thicken, lift, or deform. The surrounding skin can become tender or discolored, and slight bleeding with pressure is not unheard of. What makes this especially deceptive is that subungual melanoma often does not hurt. It grows quietly, spreading downward into the tissues under the nail bed. Many people mistake it for a fungal infection, and without a close look, even clinicians can miss it. There is an important distinction, though. Fungal problems usually alter texture first, crumbly, brittle, thickened nails, while melanoma more often changes color and shape from within the nail unit. One practical clue stands out. A true bruise migrates outward as the nail grows. A suspicious pigment band tends to remain anchored in place week after week. If you see a streak that stays put or steadily widens, do not wait for it to vanish on its own. Early evaluation can be the difference between a straightforward surgical removal and a malignancy that extends beyond the toe. Your toenails may be small, but the message they carry can be significant. The next time you trim or polish them, pause and look deliberately. That single line might not be dirt or an old injury. It could be your body's quiet warning, one you were never meant to overlook. 3. Changes in skin color or texture. Pause and examine your toes closely. Do you notice new dark spots, areas of redness, or a glossy sheen that wasn't there before? Maybe there is a tiny mark beneath a toenail, a streak that refuses to fade, or a patch of skin that feels different, tighter, smoother, or unusually polished. Most of us dismiss these things. We assume it is a bruise, irritation from footwear, or simple dryness. Yet small shifts in color or feel can be your body's way of signaling a deeper problem, one that may not be limited to the skin. One of the most dangerous skin cancers, melanoma, does not always appear where people expect. It can begin beneath the toenails, in the spaces between the toes, or on the soles, places that get little sunlight. That is what makes it so deceptive. By the time many people recognize it, it has already grown downward or begun to spread. Early on, it may resemble an innocent mole or a slender dark line under the nail. With time, it changes character. Edges turn irregular, color becomes more intense, and it may start to bleed or feel sensitive. In other cases, the skin takes on a stretched look, becoming shiny, tight, or reddish, as if pressure is coming from below. Changes like these can point to involvement of the circulatory or lymphatic systems, which may occur when cancer cells begin to affect blood flow or tissue health. The challenge is that toes endure friction, heat, and constant contact with shoes, so shifts in tone or texture are easily mistaken for blisters or calluses. Cancer-related changes do not heal like normal skin. They persist, they progress, and they keep catching your eye. If you see a dark area that continues to expand, a nail stripe without a history of injury, or skin that looks unusually polished or discolored, take it seriously. Get it evaluated, because melanoma detected early is highly treatable. Ignored, it can become one of the most lethal cancers. The next time you check your feet, look beyond dirt or minor nicks. Pay attention to the story your skin is telling. Subtle shades and textures can be the first quiet signals of something your body urgently wants you to notice. 4. Swelling. Ever glance down and find your toes or feet puffed up, even though you didn't spend hours standing, didn't injure yourself, and didn't overdo the salt? You prop your legs up, expecting it to settle by morning, but the fullness lingers or even worsens. That kind of unexplained swelling can be more than simple water retention. It may be your body quietly flagging a blockage in the lymphatic or circulatory system, a problem that can arise when certain cancers start developing deeper within. Your lymphatic system works like a built-in drainage network, clearing waste, toxins, and excess fluid. When cancers grow in the pelvis, abdomen, or lymph nodes, they can compress lymph vessels and slow or completely obstruct this flow. When that drainage backs up, fluid tends to collect in the lower body, feet, ankles, and toes. Early on, it might appear as mild puffiness. Shoes feel tighter, sock lines press deeper, and your feet seem unusually heavy. With time, the swelling can become firmer, tender to the touch, or take on a stretched, shiny look. It doesn't always hurt, which is exactly why it's risky. People dismiss it as nothing serious, and that's how cancer hides inside the everyday things we overlook. This form of swelling, called lymphedema, is often associated with cancers such as ovarian, prostate, kidney, or those involving the lymphatic system. When it shows up without a clear explanation, it's your body's way of signaling that something is blocking the flow. If you notice persistent swelling in one or both feet, especially if rest doesn't help, or you see changes in skin texture or color, don't ignore it. Your feet may be reflecting a problem much higher up, because sometimes the earliest cancer warnings don't arrive as pain or fatigue. They appear as the quiet swelling you expected to fade on its own. 5. Persistent numbness or tingling. Do your toes go numb or prickle even when you haven't been sitting too long or squeezing into tight shoes? You shake your foot, hoping it fades, but the feeling returns or never fully leaves. It's easy to chalk it up to sluggish circulation or a pinched nerve. Sometimes, though, it signals something deeper interfering with nerves or blood flow. Certain cancers, particularly lymphoma, leukemia, and multiple myeloma, can involve the peripheral nervous system. They may release substances that injure nerve endings or reduce blood supply, creating that steady pins and needles sensation in the toes, feet, or fingertips. Early on, it's subtle. You tell yourself, I probably slept funny. Over time, it creeps from one toe to several, spreads across the foot, and can even travel up the leg. Cancer doesn't always strike directly. It can press on nearby nerves or disturb the pathways that carry messages between the brain and the limbs. When signaling is disrupted, sensations get scrambled, and your toes may register burning, tingling, or even a complete loss of feeling. If this sensation keeps recurring or grows worse, don't brush it off. Nerves are messengers. When they speak through numbness or tingling, it's the body's early call for attention. Not every episode of tingling points to cancer, but when it's persistent, spreading, or lacks a clear cause, it's worth getting evaluated. Early awareness can be the difference between recognizing a problem and overlooking a warning. 6. Slow healing sores or wounds. Non-healing foot sores that persist beyond 2 to 3 weeks, especially if they have rolled or pearly edges, a crusted surface, or a pigmented rim that keeps spreading, deserve a professional exam and often a biopsy to rule out skin cancers such as basal cell carcinoma, squamous cell carcinoma, or acral lentiginous melanoma hiding on the sole or under a nail. A helpful at-home clue that a wound is circulation-related is dependent rubor. When the foot is lowered, it turns reddish, and when elevated, it becomes pale. This pattern points toward arterial insufficiency rather than simple friction. Another overlooked signal is pain out of proportion when the foot is elevated in bed but easing when it hangs off the side. Classic for ischemic ulcers. Risk multipliers include smoking, diabetes, kidney disease, and prior radiation or chemotherapy, which can all blunt the normal stages of healing. Early vascular testing such as an ankle brachial index, plus a dermatology evaluation for suspicious borders or pigment, can separate a treatable blood flow problem from a malignancy that needs swift excision. 7. Color loss or pale toes. Sudden or persistent pallor, bluish discoloration, or toes that feel markedly colder than the surrounding skin can reflect reduced arterial inflow or sluggish deoxygenated blood. If color changes worsen with elevation and improve when the foot dangles, that points to arterial disease, whereas color that turns dusky purple and puffy with dependency suggests venous congestion. Intermittent episodes triggered by cold or stress, marching from white to blue to red, fit Raynaud-type vasospasm, constant asymmetry, loss of pulses, or new numbness lean more toward structural blockage from atherosclerosis, emboli, or, rarely, tumor compression of vessels. A quick bedside check is capillary refill. Press the toe pad until it blanches and time the return of pink. Clearly slower on one side warrants evaluation. In advanced systemic cancers affecting the heart, lungs, or blood, pallor may pair with breathlessness, chest discomfort, or fatigue. Clustering symptoms increases the urgency for cardiac, pulmonary, and vascular assessment. 8. Thick, curved, or clubbing nails. True clubbing is more than a thick nail. It's a fingertip or toe tip that becomes bulbous with the nail angle, Lovibond angle, opening beyond 180°. Loss of the tiny diamond-shaped window when the nail tips of opposite toes touch, Shamroth sign, and a soft, spongy feel at the nail bed on gentle pressure. It can evolve over weeks to months and is classically linked to lung cancers, but also to chronic lung infections, interstitial lung disease, cyanotic heart disease, inflammatory bowel disease, and certain liver disorders. In some patients, it's the first visible clue before internal symptoms declare themselves. The leading mechanism involves large, unfiltered platelet clusters and growth factors like VEGF and PDGF reaching the distal circulation, stimulating tissue overgrowth around the nail matrix. Rapidly developing unilateral clubbing or dramatic curvature confined to one toe is atypical and should prompt imaging to exclude local causes such as vascular malformations or a tumor along the limb. 9. Persistent itching or dryness. When itchy, flaky, or overly dry skin on the feet doesn't improve with moisturizers or antifungal creams, it can indicate more than a surface problem. Persistent itching, especially without a rash or visible irritation, may be linked to internal chemical signals. In cancers such as Hodgkin's and non-Hodgkin's lymphoma, the body can release excess histamines and cytokines, immune messengers that trigger nerve endings and produce the sensation of itch. This type of itch often feels deep, as though it comes from beneath the skin rather than the surface, and tends to worsen at night or after warm showers when circulation increases. In some patients, chronic itch precedes other symptoms like swollen lymph nodes, fatigue, or weight loss by months. Additionally, certain liver or bile duct cancers can cause bile salts to accumulate in the bloodstream, leading to intense itching that often starts on the palms or soles before spreading. If the skin looks normal, but the itching persists, spreads, or pairs with night sweats or unexplained fatigue, it deserves medical evaluation. 13. Extreme coldness or temperature change. When one or two toes consistently feel colder than the rest, even in warm environments, it can indicate an imbalance in blood flow or vessel integrity. In the context of cancer, this symptom may arise from tumor-related vascular compression, thickened blood, a paraneoplastic hypercoagulable state, or nerve disruption affecting temperature regulation. Some cancers, particularly pancreatic, lung, or kidney types, can increase clotting tendencies, leading to small arterial blockages in peripheral tissues. This condition, known as microthrombosis, reduces oxygen supply and makes toes feel cold, numb, or even slightly blue. A subtle test is to compare both feet. A temperature difference of more than 2 degrees Celsius between them can signal compromised circulation. Another possibility is autonomic nerve damage caused by chemotherapy or by the cancer itself, leading to poor regulation of blood vessel constriction in the toes. Persistent coldness that doesn't respond to warmth or massage should be medically assessed through Doppler ultrasound to measure blood flow. Ignoring this sign can risk tissue damage or indicate systemic vascular complications that need immediate attention. 14. Unexplained pain that comes and goes. Intermittent toe pain that worsens at night can reflect nocturnal ischemia, where blood flow to the most distant tissues dips when you're lying down, and overall blood pressure is lower. In people with hidden vascular disease or blood disorders, that slight drop can be enough to trigger migrating, hard-to-localize pain. Another lesser-known pattern is referred pain from the lower back or tarsal tunnel. A small disc bulge or tibial nerve crowding can create on-off pain in the toes, even when the toes themselves look normal, which is why normal-looking skin and nails don't rule out a deeper cause. A simple at-home clue that the pain might be vascular rather than muscular is delayed capillary refill. Press the toe pad until it blanches and release. If normal color takes clearly longer on the painful side than the other foot, that's a sign to get it checked. Red flags that deserve prompt medical evaluation include pain that wakes you from sleep, pain with new color change, pale, blue, or dusky, new ulceration, or paired systemic symptoms like unintended weight loss, night sweats, or persistent fatigue. 15. Loss of sensation or weakness. Stocking glove. Sensory loss, that is, numbness starting in the toes and creeping upward, often reflects the longest nerves being affected first. When it's perineoplastic neuropathy, this spread can feel surprisingly fast compared with more common causes like diabetes or B12 deficiency. Small fiber neuropathy can make toes feel paradoxically normal to touch on a quick exam, yet exquisitely sensitive to temperature or light brush, allodynia. Noticing that warm water feels burning hot on the toes but not on the calves is a classic early clue. Subtle weakness often shows up in fine tasks before walking changes. Difficulty spreading the toes, repeatedly rising onto the tiptoes, or holding a sheet of paper between the toes compared with the other foot. Autonomic nerve involvement can travel with sensory loss. Unusually dry or overly sweaty toe skin, reduced hair growth on the forefoot, or temperature asymmetry between feet can all hint that nerves, not just skin or joints, are involved. Because many non-cancer conditions can mimic these signs, e.g., diabetes, thyroid, or B12 issues, alcohol-related neuropathy, spinal stenosis, pairing a neurological exam with basic labs is often the quickest way to sort benign from serious cases early. There you have it, 15 quiet yet powerful signals that your toes may be alerting you to something serious. Stay calm. Many of these signs have harmless explanations, but if they continue, it is wiser to get evaluated. Cancer found early is often highly treatable. Your body whispers before it shouts. Do not wait for the shout. If this video helped you, type "Awareness Saves Lives" in the comments below. And remember, early detection is not fear, it is wisdom.